I'm Fred Schreuder. I'm a consultant plastic surgeon with a specialist interest in hand surgery, and I practice here at Hatfield Hospital doing the entire gamut of plastic surgery, including hand surgery. Carpal tunnel syndrome is a very, very common condition that affects the hand, and it is due to pressure on the nerve in the wrist in an area called the carpal tunnel. And this nerve is the most important nerve for sensation in the hand, and that's why patients with carpal tunnel syndrome start getting symptoms related to pressure on the nerve. Carpal tunnel syndrome can affect everybody. It typically affects women more commonly than men, but I see patients of all ages and both sexes. It's a very, very common condition, and I'm sure once you mention the diagnosis of carpal tunnel syndrome, you'll be surprised at how many other people have been treated for it. In general, the signs are due to signs of pressure on the nerve. So patients get pins and needles, they get numbness, sometimes burning sensations, sometimes a feeling of stiffness in the hand. The typical signs and symptoms are nighttime symptoms. So patients wake up with a tingly dead hand that they have to shake out or drop over the end of the bed. Some patients get symptoms when they're using the phone, cycling, or driving the car. Some patients will notice that actually their hands are less dexterous because their fingers have got numb. The treatments of carpal tunnel syndrome depend on the severity of the carpal tunnel syndrome. For very mild carpal tunnel syndrome that's only causing minor symptoms at night, a splint which keeps the wrist out straight may be the most appropriate treatment. Thereafter, things like steroid injections can be tried, and most patients will benefit from a steroid injection. The benefit may be short-lived or it may be quite long-term. I think most patients can have 2 steroid injections before they need to think about the surgical option. Surgery is very effective at treating carpal tunnel syndrome, but not everybody needs surgery. The recovery time after carpal tunnel syndrome surgery is actually longer than most patients would anticipate. Although it's a local anaesthetic procedure performed on an in and out basis, the recovery time is longer than you would expect because it involves the hands. So I say to most patients, you will probably need 2 weeks off work. Again, patients who have more manual jobs may need longer than that off work. The first week is the most difficult because you have a big bulky bandage on, so you may need help at home. I also advise patients that it may be up to 2 weeks off driving, so they need to take that into consideration. The most difficult problem for patients further down the line is pain on the scar, and this is called pillar pain. And it may mean that you won't be able to do Pilates or go to the gym for 6 weeks to 3 months after surgery. This does settle down. Even with pillar pain, most patients have a really good resolution of the nerve symptoms, which are the pins and needles. Carpal tunnel syndrome can unfortunately reoccur. The treatment rate with surgery is 90 to 95%. So 90 to 95% of patients can expect a full resolution of their symptoms. There are a proportion of patients that will get recurrent symptoms. Some of them recur very, very early, and this may be due to scar tissue or swelling. Some patients can recur down the line many years later, and this is usually due to other factors. Patients can come and see me with carpal tunnel directly. However, a lot of patients will come and see me because they go to the GP with symptoms that the GP thinks are carpal tunnel syndrome, and they come to me for confirmation and treatment of this condition. I also see patients that the insurance companies will direct to me for treatment of carpal tunnel syndrome.